This is a real family that I saw, one of the first families I probably saw in practice, so it's been quite a while. But I still am in touch with the family and it sticks with me for a number of reasons. So my original patient was diagnosed with breast cancer at age 57. That's not a particularly concerning age. And when I saw them, this was 15, 17 years ago, it certainly wasn't. I think at the time, we were really only recommending genetic testing if a person was diagnosed with breast cancer under the age of 40 or maybe 45. But she reported when I saw her that her mom had, quote, ovarian cancer. That's what she was told. At age 47, she had surgery, nothing else, and died of a stroke at age 90. Well, having done this a number of times as the genetic counselor, I was pretty skeptic. It's pretty unlikely for a patient to live 40 years after an ovarian cancer diagnosis back in those days. This would have been, maybe the 60s or something like that. And so I thought maybe it wasn't truly an epithelial ovarian cancer, but this is the family story, so we'll go with it. But I did have some skepticism in the back of my mind. The patient was adamant about doing testing. She was found to have a pathogenic variant in BRCA1, which made me sort of eat my words. My skepticism went away because it's very possible that her mother did have ovarian cancer. It was just caught early and it never came back, and she was one of the lucky ones. Of course, she was deceased, so we could never prove that, but it taught me a lesson there. We tested both of her daughters, and they're twins, not identical, but they both tested positive for her BRCA1 mutation. And in this situation, the daughters were completely different in their approach to managing their risk. One of the daughters chose all the screening. She did ovarian surveillance, she was doing breast MRIs, while the other daughter took very aggressive actions to lower her risk. She immediately had her ovaries and tubes removed. She had bilateral mastectomies with reconstruction. And then sadly, that patient was diagnosed with pancreatic cancer at age 46. And this was really difficult for the family to sort of grapple with and accept, as you can imagine, particularly given that of the two, this was the daughter who wanted to keep herself from getting cancer by any means. She did all of the possible surgeries at the time. But I think this story, while, sort of sensational in that it checks all of the boxes, teaches us a lot of lessons. Sometimes the family history information is correct, even when unlikely. I think we all have a tendency to go, okay, patient reported history is not always confirmed, which is true, but sometimes it is. Risk associations change over time. When I counseled this family, pancreatic cancer and being associated with BRCA1 and 2 was not a thing. We did not discuss pancreatic cancer, didn't discuss any screening. I don't even think it was available at the time, but it's something where, as we know more, what we told patients at the time was correct, but we're getting smarter about these things all the time. And lastly, of course, that the most aggressive risk reduction choices do not eliminate cancer risk. And of course, this patient wasn't going to have a Whipple to prevent pancreatic cancer, but she could have even developed a breast cancer or an ovarian-like cancer after those risk-reducing surgeries. And it's just important to make sure that patients are aware the extent of limitations when they're making these really hard decisions.